So to those watching, good morning, and thank you very much for coming to the first of two Q&A live stream sessions we will be holding. My name is Yasmin Abbas, and I will be hosting this short live stream session today. I would like to begin today's session by briefly explaining the aims of this Q&A series. This event is organized by APEC Ghana in collaboration with Ghanaian healthcare professionals, Madame Emma Akua Amoah and Dr. Charles Buckman. APEC is the sole preeclampsia working advocacy agency in Ghana with the aim of saving the precious lives of mothers and children with prevention and support. In alignment with the mission of APEC Ghana, which is to provide education on preeclampsia and raise awareness, this Q&A series began with a 3-week-long campaign to collect questions through the APEC Ghana social platforms about hypertensive disorders of pregnancy. This project continues today, as well as the next Tuesday, July 13th, with the answers in collaboration of Madame Akua and Dr. Buckman, who will give answers to the questions asked by the audience. The project will culminate with the sharing of these answers through recorded live stream sessions and take-home messages which will be found on the APEC Ghana social media platforms after the closing of the Q&A series next Tuesday. Now, I would like to introduce our healthcare professional today, Madame Akua.
Hi.
Here with us to answer questions you have sent in is Madame Emma Akua Amoah. Madame Akua is a midwifery officer and holds a Bachelor's of Science in Midwifery. Madame Akua, thank you very kindly for joining us today for this event and helping us learn more about hypertensive disorders of pregnancy.
Thank you for having me.
Incredible. So I will begin with the questions already asked by our social media platforms and give Madame Akua some space to respond. And if time permits, we will take the live questions from the audience of the live stream. One of the first questions that we had sent in to us was, why is it difficult for a woman with eclampsia to have a stable blood pressure after delivery? Madame Akua will share the response in English and then do a translation in Twi. Please go ahead. Thank you.
Thank you for having me. Good morning to our cherished listeners and those viewing from far and near. This is difficult because preeclampsia is a very difficult, it's a complication that affects pregnant women. And then the actual cause of this condition is not exactly known yet, but experts believe it begins from the placenta, the organs that nourishes the baby throughout pregnancy. And then we want to ensure that women to be recovered properly after embarking on this condition before embarking on another pregnancy. It affects their blood vessels, which do not develop properly when this condition occurs. So, hello, can you hear me, please?
Yes, yes, you can. Thank you.
Yeah. So like I said, so in early pregnancy, new blood vessels don't seem to develop or function properly. They are narrow than normal blood vessels and react differently to hormonal signaling, which limits the amount of blood that can flow through them. And this affects, there are a lot of organs in the body, the hearts, they develop heart diseases, they develop renal failures, brain injuries here and there. So because of that, women need to recover properly before embarking on new pregnancies. Thank you.
Madame Akua, if you would like to make the translation in Twi now.
Yeah. Obi busa say, yeah. Obi busa say, di entina omo anya preeclampsia. Eye din say omo benya stable BP. Omo BP no be ko form na say e be stable amomo a enko soro bio. Enam say yare yi a ye ka ho asem. Yen se dan nimu adekode potia e de ba. Na emom ye kirekire mu say eye ana shase fi awode akire ade no ho na ekutia mai efa yarewa yi ho na oba yi nya yare yi a ehun sunsuanso boni bi a etumi so na koma etumi so ne hwirawa mu bi etumi so mpo ne n'adwene mu nyinaa no ɛyɛ a etumi didi wɔ nipadua no mu ma the BP no enkonkan enye stable abrɛ ne abrɛ nyinaa no ɛnam yare na tumi nipa no honam dua nipadua no nti no ohia sɛ wɔ sɛ onya ne ho tɔ ne yie ansana wasan asusu adwene sɛ ɔbɛfa yefunu bio nti ɛnam nsunsuanso bɔne a yare no tumi ɛhye na herawa no na koma na adwene mu nti ɛna ɛyɛ a na ɛma BP no entumi ɛmma fam saa prɛkopɛ. Thank you.
Thank you. I think we will move on to the next question. Is there any evidence of a connection between SLE and preeclampsia? I have markers in my blood, ANA positive, I think, but I have no symptoms of lupus. I had an autoimmune screen done after developing severe preeclampsia. I also have hypothyroidism diagnosed 20 years ago, but I've been told that this does not cause preeclampsia. So again, the question would be, is there any evidence of a connection between SLE and preeclampsia?
Thank you. Once again, the study has not really shown any connection between preeclampsia and the SLE. But then it's not really, the study has not really showed much, though neither expert has also shown it. But what we know about this preeclampsia, one of the risk factors is as a result of the placenta. Placenta organs being affected. So the study has not really shown much about these. Thank you. And you want to say, Obi Busa, say preeclampsia and SLE, you know, a home bambobi, and I say, and any boy brebi etumima preeclampsia bana. You want to say, and Shushamun said, don't reporting say, SLE and I say preeclampsia, and then no about a brebia. Bania ye ni mo no say nam say placenta na echire ade no eputia eno paamu na yare no ehya ase efi eno ne ebetumi agina so aka potin say etumi de ba na mmom SOE de nhwehwemu nhyeda enkyerɛkyerɛ mu potin na mmom nhwehwemu omuguso omu ye nhwehwemu am ye hu say ene ne bo abura ana ene ne mu abura me da ase. Thank you.
Thank you so much. Also, a reminder for those of you who are watching the live stream via Facebook that you can leave your questions below on the chat. Thank you. The next question reads as following. As a preeclampsia and HELP survivor, how should I prepare for a second pregnancy? What is the risk of having these conditions again?
Thank you very much. How does she prepare? Even in normal pregnancy or in normal childbirth, we encourage that women recover at least 2 years before embarking on new pregnancy. So if you have been affected or you are a survivor of preeclampsia or HELP syndrome, we still encourage that after 2 years, you know you are well recovered before embarking on pregnancy. Aside that, you'll be visiting your specialist or your obstetrician to be assessed, to be monitored before he can prepare you towards the new pregnancy. And then she also asked if it's likely she will develop preeclampsia again. Yes, she can, because we say one of the risk factors of preeclampsia is previous history of preeclampsia. So if you have had preeclampsia before, the possibility of you developing preeclampsia in your second pregnancy or third pregnancy, it's possible. But then with good management, we encourage that when it is being planned, it's being monitored or properly managed, it will be better, they will have better outcome than the previous ones that was not known and it happens suddenly. Thank you. And your woman is obi busta say so obi a wanya preeclampsia da no obetumi anya bibie mu ana. Yes, I am. If you see a car say omo wanya preeclampsia da no ana na ye di preeclampsia ba ye obi a wanya bi da obesi atumi anya bibie. Na breben obi a wanya preeclampsia na say HELP syndrome otimi fa yefunu bio. Nye omu no say nyinsem po sa wankasa wawo oho so ahwe nye wo no ye encourage say at least mfie mienu ansa na wasen anyem Na se bibi say Akua. So you go so I encourage you say obetwentwen so mfie mienu at least. E bedru ho no na wo ho ahenka wo yiye. Eno nso na ewo mu say wo say wo hu specialist and our obstetrician. Na ukọ clinic, ukọ consultation, ukọ reviews, no show, no assess so. Or monitor say okay, at this time they obetumi afa yefunu bio. Na ufa yefunu so ana eni atumi akọ ho Amoah hwe yiye. Na de ebe ya na see first no. And I'm say ya prepare and sana wo be fa yefunu. Obehwe ama bibia kototin na emu sa no. Ni ebe fi mu aba no beye asene ni a di kan see ye no. Medase. Thank you.
Thank you very much.
Thank you too.
And the next question would be, what are the long-term effects of preeclampsia?
Thank you. Some of the long-term effects of preeclampsia, the person can develop heart diseases, the person can develop stroke, there can be brain injury, the damage of the lungs, and even the eyes, like the vision. People can lose their vision, which I've witnessed one at my previous work facility, that the woman became blind as a result of preeclampsia and its complications. So some of these things are the long-term effects of preeclampsia: heart disease, stroke, brain injury, damage to the lungs, and eye problem. Thank you. Obi busa say unya preeclampsia ehun sunsanso a ewo da achi bi kura no eye mu de wahi na muye wo mu ne say obetumi anya akomayare na obetumi anya stroke sabe wadwin betumi aye ntawantawa kakra na wahrawa nso na am say yare na echi wahrawa mu lungs mu nti no obetumi develop lungs problem damage na wani nso anhwe a obetumi anya nifraye because ehya ase na wani so brew ni ade na ya nso mu yi a sabe wani kura tumi fra. That's it. Thank you.
Thank you very much.
Thank you too.
This is a bit of a longer question. I had preeclampsia in my first pregnancy in 2018. As a result, my BP was well managed with medication in my second pregnancy from 2020 through to May this year, and I had no problems except for the early onset of gestational diabetes. However, a week after delivery, I noticed my BP started to rise, even though I was on the same medication in the same doses like when I was pregnant. I was readmitted and managed for postpartum hypertension and another medication added on. I can't seem to understand how this would happen. Could the preeclampsia in the first pregnancy have resulted in this as well as gestational diabetes? Thank you.
Thank you, darling. Yes, she had preeclampsia during delivery, and after delivery, she still had preeclampsia. It is possible. We have postpartum preeclampsia. This is because when the blood pressure is not able to control, uncontrolled high blood pressure before you are pregnant or after delivery, it's likely to occur. And then postpartum also begins from the day of birth up to 6 weeks. So you are likely to develop preeclampsia postpartum. That is why we encourage our women that one of the things we need to do to prevent this condition is we need to have adequate rest and sleep. And as a new mother who has had a baby, she needs to breastfeed baby, she needs to give baby attention here and there. I mean, she's not resting, she's not sleeping. So she's likely to develop this condition. And then if the condition is not properly controlled during the delivery or during pregnancy, it's likely to occur postpartum. Near one month, so people say when you're preeclampsia, your man in growing na no also. Or we yen so the hot on, or we na ben na watch and na watch no was saying your preeclampsia. I mean, I said they need to send you corona so. Yeah, a brain na yeah, sham man crying. So, oh, I was ultimate make a crack. Now, and I'm saying, my wow for. I was watching any map cry no for on that collection or be sharp cry or be away or be away into a man in na to me na and I postpartum to share say if you da wow popim na watching nsia and sana placenta ne ho nso so nyina afifi wo and the BP no say e wo ho and sana wo na say yan control ni yie and I am chance me now umpa ube send to me anya bi or pay me say ube at the 6 weeks ube send to me anya postpartum preeclampsia. That's it. Thank you.
Thank you very much. The next one reads, Good morning. My name is Sheena from Nigeria. My wife gave birth on Wednesday, but it was stillbirth due to preeclampsia at 34 weeks. He said it was due to blood pressure. He assured us that it won't recur in the subsequent pregnancy because she has immune to fight it. I would like to confirm if this statement is true, and also when it is safe for my wife to get pregnant again. Thanks in anticipation. We touched upon this question, I think, briefly, but maybe if you want to reiterate some points or add something, please feel free to.
Thank you, dear. Yes, it's unfortunate for that loss. Like we said, preeclampsia causes or risk factors are people who have had a history of a previous preeclampsia. The wife can, the doctor who told her it won't happen again. I don't want to say that it's not true or something, but then it's likely to occur. But now that we know that she has developed this condition, if she starts seeing her obstetrician for counseling and then assessment, you monitor it properly, the outcome of the second pregnancy will be better than the previous pregnancy. Thank you. Obi busa say ne yiri fa yefunu na preeclampsia na santi o shre ne ba na 33 weeks. Na o busa say empo na obusa ne doctor no o say o onsha den na onyimu bi mo preeclampsia no edi ma. Yentumi nkasa because if you say unya preeclampsia wobetumi anya bibio. Enti was I starting who specialist no boa kakra or assess so no hwe the bibia totin na na liko ho a wo wundro so kama ufa yefuna it will be successful for you for the second time. Thank you. That's it.
Thank you. A question about preeclampsia. My baby was stillborn due to preeclampsia and I was extremely poorly. Since then, I have found it hard to get pregnant again. We have now been trying for 18 months. Could this be due to the effect of preeclampsia had on my body?
Thank you. Sometimes psychologically, we are not sound, we are not stable. I mean, sorry for that loss, my dear. I want to encourage that you have enough rest, you have a stable mind before even in normal pregnancy. We encourage that you have a sound rest, a stable mind to be able to achieve a pregnancy. And with this condition has happened, I mean, the perception, the inward pain, the agony, the psychological traumas can delay other things. I want to encourage that she will continue to see her specialist for further management to be assessed on and then be monitored, or to be assessed on further management on other things. I don't think it's the cause of the preeclampsia that is delaying her new pregnancy. Thank you. Obi busa se wanyumuyama oshrene ba na ama 18 months ni afi ba ko ne fani opese wo fa yefunu bio so ye ya emba preeclampsia no nya ye ni tia na da bi sabe wo fa yefunu na wo hwere wo ba ensunsan so kra fefa utimu ne wadwum kra no etimi delay nioma enti ye pese ye hye ne nkran se obehya den no hu ne specialist no aboa no na mpo se ebia na bibi fufuro nso kra wo ho na delay ni nsem na nso enye chinchina se preeclampsia and a delay in that's it. Thank you.
Thank you very much.
Thank you too.
When is the best time to get pregnant again after severe preeclampsia experience, my first pregnancy and losing my baby?
Thank you. We encourage, even in normal pregnancy with normal labor, we encourage that you recover for 2 years before you embark on new pregnancy. And with these that have had issues with pregnancy, we want to encourage that you still have enough rest. You see your specialist, you will be assessed, you will be taken through some counseling. After especially assessed you and he feels the condition is stable, you can embark on pregnancy. Why not? We will assist you to go ahead with a new pregnancy. Obi bisa said washre ne nyin se time ben pa na wo se after preeclampsia otimi fa yefunu bio. Ye kire mu se mpo normal nyinsɛn kora no yɛsi home mfeɛ mmienu ansa na wasan ahwehwɛ nyinsɛn foforɔ na wei nso a biribi a bɛtɔ mu no yɛpɛ sɛ yɛhyɛ wo nkuran sɛ kɔsoa no hu specialist no ɔboa wasɛ sɛ wɔhwɛ no sɛ biribi a ɛkɔ yie a ɛno no wobɛtumi ato ase afa wo yɛfu no second time. That's it. Thank you.
Yes, we have another question. Does preeclampsia cause symmetrical IUGR? My baby had symmetrical IUGR. They thought about storage infection and chromosomal anomalies, but lastly, I developed severe preeclampsia. So the question is, can preeclampsia cause symmetrical intrauterine growth restriction?
Thank you. Preeclampsia is capable of causing IUGR because it is the placenta that nourishes to give the baby nutrients to grow or to develop in utero. So if the placenta is affected, oxygen is insufficient to these fetus. Other good nutrition are insufficient to the fetus to develop properly before 10. So it's possible. It can cause IUGR. Thank you. Obi busa sɛ sabi yefunu a akora no ɔnduru ne mfie papa wɔ yefunu no mu ebi akora wɔ sɛ ne weight kora na ne bibi no otumi nya ebi a 39 weeks no nso nko hu akora na kete obisa sɛ preeclampsia betumi edisa nsunsuanso no aba nkora so ama ɛyampa ɛnam sɛ akora no nya ne home ne bia ne fi placenta ne mu ana ichiradeɛ ne mu na sɛ ichiradeɛ no is affected a ɛbɛyɛ den sɛ oxygen ana nnuane pa a ɔbɛnya de ama akora no etumi anyi wɔ yefunu mu ansa na yawo no ɛbɛtɔ kyim. That's it. Thank you.
Thank you so much, Madam Akua, for your deep knowledge, and this has been very educational. We do have one additional live question that would you be willing to answer?
Thank you for having me. Yes, please.
Thank you so much. We have received a question, and it reads: you mentioned that preeclampsia has long-term complication on the lungs. How does this happen, please?
Hello, please, can you repeat your question?
Yes, of course. You mentioned that preeclampsia has a long-term complication on the lungs. How does this happen, please?
Thank you. The preeclampsia affects the lungs because when this condition occurs, it affects the lungs, breathing difficulty, organ damages here and there. So it's difficult for this woman to be able to breathe properly, to have enough oxygen becomes insufficient to the woman to be able to survive. That is how come that the lungs are being damaged. So we try to give maybe an additional oxygen, artificial oxygen to what the woman has to help the woman have a proper breathing. So by so doing, or in excessive intake of oxygen can also affect the lungs.
I don't see any more questions. So with that, I think this has been an incredibly educational session. Thank you to the very profound knowledge that you have shared with us, Madame Akua. It's been a true pleasure. This live stream session has clarified a lot about how to take care of yourself as a survivor of a hypertensive disorder of pregnancy, the importance of monitoring your health with your obstetrician, and the other effects that preeclampsia can have beyond pregnancy and in long-term situations. Thank you so much.
Thank you, sir.
And we will have another session with Dr. Charles Buckman, and you can follow us on Instagram, Twitter, and Facebook to keep up with this information, as well as visit the website for more information on preeclampsia or on APEC Ghana as a whole. Madame Akua, thank you so much. It's been a big pleasure. Thank you.